In other news this morning, Houston Methodist Sugar Land Stroke Unit is getting national recognition.
And we have with us Dr. Wanda Ahmed, the Director of Neurocritical Care at Houston Methodist Sugar Land Hospital. Dr. Ahmed, thank you so very much for joining us.
Thank you and good morning.
Now, can you tell us about the stroke awards the hospital received from the American Heart and Stroke Associations?
Absolutely. We are delighted to receive this award. It's the highest of its kind, the Gold Plus Honor Elite Plus. It's awarded to hospitals that provide the best stroke care based on scientific evidence. And that's shown to improve outcome for our patients, reduce risk of disability, reduce risk of death.
Just how prevalent are strokes in your area?
So stroke in general in the United States are the leading cause of disability. Approximately there is one stroke every 45 seconds. The annual rate is about 700,000 in the United States.
Currently, how many stroke patients are you treating, or is the hospital treating right now?
You know, I can't recall the exact number, but on average, we have about 15 and 20 patients with stroke in the hospital.
And we know that stroke can absolutely be devastating if someone doesn't get quick treatment, if they don't get the right rehab. What are some success stories? Can you share perhaps something that they can show us and demonstrate just how you've been able to succeed in your stroke department?
Absolutely. These are the best stories that make us come to work every day. We have recently started in Houston Methodist Sugar Land providing an advanced type of stroke care called thrombectomy. So traditionally, stroke patients are able to receive an acute treatment for stroke called TPA, which is a blood thinner that dissolves clot for symptoms onset until 4.5 hours. But currently, the stroke care has progressed throughout the years, and the most advanced care is to be able to provide a thrombectomy, which is literally a mechanical retrieval of the clot with a catheter from inside of the brain. And that particular procedure, the window is expanded to 24 hours. So we had several success stories recently. We had actually 2 patients in 1 week where they came in with a large vessel occlusion on the dominant side of the brain, typically the left hemisphere, which is associated with high disability because that side of the brain controls speech and ability to understand and ability to communicate, and also causes paralysis on one side of the body. These patients were able to come to the hospital within 24 hours of their stroke onset of symptoms, and through the emergency room department, which is really the backbone of our stroke program, they were able to identify that stroke, and we were able to treat them acutely. Essentially, our neurovascular surgeon, Dr. Lau, was able to put in a catheter through the groin, thread it all the way to the brain to where that vessel is located, and mechanically remove the clot. And essentially, within 2 days, the patient was walking around the unit and was able to communicate. So these are definitely the highlights of what we do.
That is amazing that now it's gone from fast treatment for a couple of hours to almost 24 hours. Wow. Can you give us some of the signs and the symptoms to look out for strokes?
Absolutely. So the American Stroke Associations have an acronym called Be Fast. I think the name says it all. So even though the window is up to 24 hours, the most important component in recognition of stroke is time. So we say time is brain. So every hour or every minute that passes, there are more brain cells that are occurring irreversible damage. So the acronym again is Be Fast. So B is balance problems. E is for any eye or visual symptoms. F for facial weakness on one side of the body, usually the same side that's weak. A is for arm or leg weakness as well. S for speech problems, and T again for time, emphasizing the importance of coming as fast as possible. So again, even though we can provide this up to 24 hours, the sooner the patient comes, the better their outcomes are.
Well, I certainly believe that conversations like this end up saving lives because they will remember what you just said to be fast. Thank you, Dr. Ahmed. Congratulations on your success at Houston Methodist Sugar Land.
Thank you so much for having us. And I might add, actually, all our Sugar Land's 7 hospitals are stroke centers, and they've received very similar awards. So wherever you are in the Houston area, close to Houston Methodist Hospital, you'll be able to receive great care.
Good to know.
Congratulations once again.
Yeah.